Assalamualikum. Hi, I'm social worker, Sumon Ahmed Ali. Welcome to my YouTube channel, Social Worker Sumon BDTV. Coronavirus, COVID-19, frequently asked questions and answer. Hashtag part-3 #. Image titled Deal with the coronavirus outbreak _ your most common questions answered. Step 141 How can I protect myself from COVID-19? The best way to protect yourself from COVID-19 is to avoid being around people who are sick with the disease. However, if the person is asymptomatic, you may have no way of knowing if they have the disease until you've already contracted the virus. Other steps you can take to minimize your exposure include 17. Washing your hands for at least 20 seconds with soap and water after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Touching your eyes, nose, and mouth as little as possible. Staying home if you are sick, even if you just have a common cold. Cleaning and disinfecting all surfaces that are frequently touched in your household at least once a day. Covering your cough or sneeze with a tissue and immediately throwing the tissue in the trash. Image titled Deal with the coronavirus outbreak _ your most common questions answered. Step 15 What should I do if I can't avoid someone with COVID-19? If you're caring for a sick family member, you may not have the luxury of simply staying away from anyone who has the disease. Wear disposable gloves and a respirator at all times when you're in the same room as the person who is sick. 18. Avoid touching the person's bodily fluids. If you wash a sick person's clothing, sheets, blankets, or towels, wear disposable gloves and don't let them touch your clothing or skin while they're dirty. Throw away disposable gloves immediately after using them and wash your hands thoroughly. While wearing disposable gloves, don't touch any part of your body, especially your face or your eyes. 19. Image titled Deal with the coronavirus outbreak _ your most common questions answered. Step 16 What's the difference between a respirator and a surgical mask? A surgical mask, or face mask, is meant to protect the surrounding environment from your respiratory issues. In contrast, a respirator protects you from anything in the environment. A respirator is thicker and fits more tightly than the face masks you might be familiar with, ubiquitous in China and other Asian countries. 20. Regular surgical face masks are not effective for preventing COVID-19. Only the N95 face masks can help protect you, and these are in limited supply. Only medical professionals who are treating people who are infected should be using N95 masks during the outbreak. Image titled Deal with the coronavirus outbreak _ your most common questions answered. Step 17 What if I come into contact with someone who has COVID-19? If you are in close contact with someone who you know has COVID-19, call your doctor immediately. They will likely advise you to isolate yourself for 14 days. If you don't get any symptoms within that 14-day period, you will likely be determined not to have the disease. 21. If you've only recently been exposed to COVID-19, any diagnostic test might come back negative. Typically, your doctor will advise you to wait a couple of days before coming in for testing, unless you are already showing symptoms. Image titled Deal with the coronavirus outbreak _ your most common questions answered. Step 18 How long should I isolate myself if I'm exposed to COVID-19? COVID-19 has an incubation period of 14 days. Generally, this means that if you're exposed to COVID-19, you could get sick from the virus up to 2 weeks after you were first exposed. Quarantine yourself and notify your doctor that you may need to be tested. From there, the public health department will monitor your progress and tell you when it's safe to leave quarantine. 22. Even if you do get sick during that 14-day period, it might not necessarily be related to COVID-19. You could get sick because of something else. If 14 days pass and you don't show any signs of illness, this generally means that you're no longer at risk for getting sick from COVID-19 or passing the illness on to others. Warning: although it is rare to pass on COVID-19 to someone else if you aren't sick, it could be possible. Take precautions to prevent the spread of COVID-19 if you've been exposed to the virus, even if you don't have any symptoms. Image titled Deal with the Coronavirus Outbreak _ Your most common questions answered. Step 19. Should I wear a face mask in public to keep from getting COVID-19? Face masks aren't recommended for the general public, and may not protect you from COVID-19. You should only wear a face mask in public if you are symptomatic. 23. Generally, a face mask is designed to protect the public from you, not to protect you from the public. The best way to protect yourself in public is to wash your hands frequently and avoid touching your eyes, nose, or mouth with unwashed hands. Image titled Deal with the Coronavirus Outbreak _ Your most common questions answered. Step 27. Can I get COVID-19 from touching a contaminated surface? It is not likely that you can get COVID-19 simply from touching a dry surface. COVID-19 is transmitted primarily through respiratory particles, emitted when a sick person coughs or sneezes. Researchers are still trying to figure out exactly how long COVID-19 can survive on surfaces, but it is not believed that it remains alive for very long. 24. Clean and sanitize items around your house that are frequently touched by people, such as television remotes, phones, and doorknobs, at least once a day. If someone in your household is sick, isolate them and don't share household items with them. Clean their items separately from everyone else's. Image titled Deal with the Coronavirus Outbreak _ Your most common questions answered. Step 21. Can pets get COVID-19? It is not yet known if COVID-19 can be spread from humans to animals. However, if you have COVID-19, you should let someone else in your household take care of any pets while you are sick and keep them out of your room. 25. Avoid petting, snuggling, or sharing food with your pet. Always wash your hands before or after interacting with your pets. We'll talk again with next update video. No more today. Allah Hafiz. Social worker Sumon BDTV.